Yep.
Alrighty. Hi, my name is Brian. I'm gonna be the nurse taking care of you today. I'm just gonna take you through a full head to toe assessment. I'm just gonna take a look at your body, your muscles, how they're working, as well as how your brain is working. And I just wanna make sure that your heart, your lungs, and just the rest of your body is working well and there's no problems there. Understand all that?
Yep.
Cool. Beautiful. Before we start, let me just wash my hands real quick. So I'm just gonna wash my hands. I'll provide you some privacy. Let me just close the door for you. There we go. All right, let me come on back over. And then can I have your full name and date of birth, please?
Jace Worrell, 11/24/01.
Cool, thank you, Jace. And do you have any allergies, Jace, that I should know about?
I do not.
Cool. And then do you have any medications that I should know about?
I currently am not taking anything.
Nothing? Okay. Beautiful. Do you have any aches or pains or anything like that I should know about as well before we start?
No pain right now.
No? Okay, beautiful. Alright, Jace, so to start off for today, I'm just going to take a set of your vital signs, which will consist of your temperature, your breathing, your blood pressure, your pulse, as well as your oxygen saturation, which is basically just making sure that your lungs are working well and you're getting enough oxygen to all your body parts. Is that okay with you?
Yep.
Cool. Alright. Before I start, let me just get all that ready. Have all that ready. Cool. Alright, Jace. And then is it okay if I touch you, Jace?
Yeah.
Alright, cool. Alright, first off, we'll start off with your blood pressure. So I'm just gonna place this around your arm. Thank you. Go ahead and assess for that vein there. Cool, there we go. Alrighty, just get that around. One second. Beautiful. Alright, Jason, give me 1 second. Cool. Alright, this is gonna get pretty tight. Alright. A little tough because I don't got enough hands on me, but let me just assess for your blood pressure real quick. Cool. So your blood pressure is 106/62. So that is normal because you're pretty athletic. So that is a good range for you. Young, healthy young man. Alrighty. Alright, Jace. Next off, I'm gonna go ahead and take the temperature. 1 second. This is gonna go across your temple right there. Alrighty, cool. So we got nice 6.4 degrees Fahrenheit, so that is normal temperature as well for you. Next off, I'm just gonna go ahead and take your pulse there. You can go ahead and just have your arm out like so, yep. Just gonna have 2 fingers on you like so. And then I'm just gonna go ahead and take a look at my watch. Time this for about a minute starting now. bit to go here. A few more seconds. Alright, cool. So you have a pulse of 75, your respirations are 16, which is normal as well. And then last thing, as a part of my assessment of your vital signs, I'm just gonna go ahead and put this little device right here, the pulse oximeter. Put that on the index finger. Do that there for a second. Cool. Check the reading. 99%. That's good. Got good oxygen saturation and oxygen going to the tissue, so that's good. Cool. Beautiful. All right, Jace. So now we're gonna go ahead and start on our actual assessment of your whole body. So the first thing I'm gonna start with is head over here. I'm just gonna go ahead and start from the top down. Is it still okay if I touch you over here, Jace?
Yep.
Alright, cool. So I'm gonna go ahead and take a look at the skull, the head, feel through the hair there. I don't feel any abnormalities there in terms of masses, no lice, no bumps or anything like that. So that's good, cool. Alright, Jason, cool. So now I'm just gonna go ahead and feel in the face right here. Yep, go ahead, just look forward for me. Feel there. Cool, so I don't feel any swelling or edema there in the face. Any masses there as well. Gonna go ahead and feel the temporomandibular joint as well. So no problems there. The face is symmetrical as well. Beautiful, cool. I'm just gonna feel the nose too. Let me just at that. Cool. So I don't feel any swelling or masses there. Looking good. Cool, cool. So now, Jace, I'm just gonna go ahead and I'm going to have you go ahead and sit tight just for a second. Alright, so face is looking okay. Let me just go ahead and move on to the ears. So I'm just gonna go ahead and take a look at your ear right there. Cool, so I don't see any discharge or any masses or cuts or anything like that on the ear. Let's go ahead and check the other one as well. Cool, so same thing here, no masses, no discharge on this ear as well. Alright, so let me just go ahead and take a look at the inside of your nose, make sure there's no discharge or any foreign bodies in your nose as well. Go ahead, just look up for me, please, just a little bit. Cool. Go ahead and take a look. Okay, no problems there. Go ahead, open wide for me, please, Jason. Thank you. You'll go ahead and say one more time. Make sure there's nothing wrong with the uvula. Good, beautiful. Cool. So I don't see any masses or any abnormalities in the mouth there. And in addition to that, I see that the tongue is pink. No cuts or anything with the tongue. It's moist in the mouth, so that's good. The lips are looking pink. No cuts or anything on the lips as well. No masses on the lips as well, so that's looking good. Cool, so everything around the mouth is looking good. Let me just move on to, let's go ahead and take a look at, let's see. Let me go ahead and feel around your throat here. Cool, so nothing wrong with the throat. With the throat, trachea is in place, not shifted to one side at all. I don't feel any swelling from any lymph nodes. And the thyroid is of normal size as well, so no swelling with the thyroid, that's good as well. Cool, beautiful. Alright, Jace. Next thing I'm gonna go ahead and do, I'm gonna have you can go ahead and stay seated still. We can move into the musculoskeletal system. So we're gonna make sure that the muscles are working well and there's no problems with the muscles. So, first thing I'm gonna have you do, Jace, go ahead, kind of mirror me. I'm gonna have you, with your neck, go ahead, look up. Beautiful. Go ahead, look down. Cool. Come back to beginning. Yep. Go ahead, look to your right. Beautiful. And go ahead, look to your left. Beautiful. Stop, Jace. And then you can go ahead. I'm gonna have you against the resistance of my hands. Go ahead, look to your right one more time. Cool. And then go ahead, look to your left one more time. Cool. So you seem to have your strength through the neck muscles there, so that's good. Let me just go ahead and feel through the spine as well. I'm just gonna take a look, make sure there's no abnormalities with the spine. Beautiful, nothing there. I'm gonna feel through the shoulders as well. So I feel the roundness of the shoulders. I don't feel any abnormalities there. Shoulders are symmetrical. That's beautiful. Cool. We're gonna do one more strength test here, Jace. Go ahead, shrug up against the resistance of my hands. Cool. So no problems with the strength there. That's beautiful. I'm just gonna go ahead and feel down through the arms here, Jace. Yep. Cool. So I don't feel any abnormalities with the arms here. Feeling through the skin. He's warm to the touch. He has just a little bit of moisture on the skin, which is normal. But I don't feel any masses or anything like that, so that's good. And the skin integrity is good. I don't see any cuts or open wounds or anything like that, so that's good. Cool. Alright, just gonna do a few more strength tests here. So I'm gonna go ahead. Before we test the strength, actually, we'll check the motion of your biceps there. So I'm gonna go ahead and have you go ahead flex them. Yep, bring them back down, straight. Cool. And then with your palms open, I'm gonna have you turn your hands so the palms face down. Beautiful. And I'm gonna have you turn the hands back up so they face up. Cool. Beautiful, Jace. Alright, we're gonna do a couple more strength tests like I said. So you can have the arms out once again. Yep. I'm gonna have you try to flex your bicep against the resistance of my hand. Beautiful. And then you can keep the hand there. And I'm gonna have you go ahead once again, try to pull your arm up, test the strength of the tricep. Beautiful, cool. So we'll test that on the other side as well. Gotta make sure both sides are strong there. Yep, same thing, go ahead, flex it, flex that bicep. Cool, gotta turn that arm, we'll check the tricep strength as well. Beautiful, cool. Stop, Jace. Let me just feel through the hands and the fingers as well. Cool, so I don't feel any problems with the hands or the fingers here. Taking a look at it, there's no redness or any abnormal color of the fingers, so that's good. Cool. So I'm gonna have you go ahead with the wrists. Alright, going through the wrists, I'm gonna have you try to bring them up, so flex them. I'll have you extend them. Go ahead, keep them there, and just kind of go a little bit further. Let me know if this hurts you or anything. Doing okay there?
Yep.
Beautiful. Cool. And then if you can, try to just kind of turn your wrists around there, like so. Beautiful. Good. A few more tests here, Jace. You can go ahead, turn your hands over. Go ahead, have your fingers out. Go ahead, flex them. Bring them back in. Go ahead, just kind of wiggle them around. Beautiful. Cool. And then I'm gonna have you try to make a fist there with both hands. Cool. So no problems with moving the hands there. Go ahead, have them out one more time for me, Jace, please. Thank you, sir. Gonna check your capillary refill, which is just basically checking the blood reaching your fingers there. So cool. So it refilled in a second or so, so that's good. That means your blood is going to your tissue just fine. So that is good. And I'm gonna do one more test with the fingers there. So I'm gonna have you go ahead, squeeze my finger. Cool, beautiful. And we'll do the same thing on the other side. Good. So don't seem to have any problems with the grip strength there, so that is good. Cool. Alright, Jace. Before we move down to the lower extremities there, I'm gonna actually have to go back up. We gotta assess the eyes, make sure there's no problems with the eyes, of course. Very important, so I'm just gonna take a look. So the eyes and the eyebrows, eyelashes, eyelids are looking symmetrical. I don't see any discharge or any abnormal masses in the going through the eyes at all. I'm just gonna have to take a look at your pupils and make sure that those are working just fine. So I'm just gonna go ahead, look straight for me there, Jace. I'm just gonna shine this light through your eye, just keep looking straight. Cool, so that one seems to be reacting just fine to the light. We're gonna do the same thing on the other eye, Jace. Same thing, go ahead, look straight for me, please. Beautiful, cool. So the other eye seems to be okay with that as well. Reacts good to light. Pupils, they look symmetrical, round, and of normal size. So that is all good. You can go ahead and keep looking straight for me. We're gonna do a couple more tests with the eyes. Make sure that they're still moving around all good. So you can go ahead and follow my finger. We're gonna come up here, follow my finger, just your eyes. Yep, come back to center, side, beautiful. Come here, cool, do the same thing on the other side. Come to the side, and up here. Beautiful, Jace. So it looks like your eyes are doing just fine, so that's good. We're gonna go back to testing your muscles once again. So now I'm gonna go ahead and kind of take a look at your hips, going through the legs, the knees, the ankles, and the feet. So I'm just gonna feel through the hips here. Cool, so the hips are symmetrical. Any pain or tenderness here, Jace?
No.
No? Beautiful. Cool. So now, to test the strength of your hips, I'm gonna have you, while I push down, you're gonna try to kind of bring your legs up while I push down on you. You ready? Cool, so no problems with that, that's beautiful. Hips are working just fine there. And then just to test the motion of your hips, Chase, I'm just gonna have you go ahead, stand on up for me if you can, please. Thank you. So testing the range of motion of your hips, I'm gonna have you go ahead, bring your, we can start with the right leg, yep, go ahead, bring that right leg forward. Come on back to the center, go ahead, bring that left leg forward. Beautiful. Go ahead, bring that leg back, or the right leg back. I'll move that chair for you. There you go. And then we'll do the same thing on the other side. Beautiful. And then you could go ahead, face the other way. Yep. I'm gonna have you bring that right leg to the side, like so. Yep. Come on back. Same thing on the other side. Beautiful. One more thing to kind of check your range of motion with the hips, Chase. I'm gonna have you open up that left hip, kind of like so, like you're stepping over a gate. Yep. Have you come on back. Beautiful. Same thing on the right leg. Good. Beautiful, Chase. Cool. Looking good. So it looks like your hips are moving just fine there. Go ahead, take a seat for me, please. Thank you. All right. I'm just gonna go ahead and feel down here. Cool. So I don't feel any swelling through the knees as well. Feeling fine there. Good. Cool. Going through the legs. Nothing bad there either. Alright, so now I'm going to test the strength of your quad here, Jace. You can go ahead against the resistance of my hand once again. You're just going to try to bring that leg up. Go ahead, try with the left leg. Beautiful. Cool. So that's working well. Go try it on the right leg as well. Good stuff, Jace. And then same thing, but we're going to test the strength of the hamstring. It's the other side, so you can go ahead and do the same thing. Beautiful. Go ahead and try that right leg as well. Beautiful, Jace. Cool, good stuff. Alrighty, next thing, I'm gonna go feel through here once again. Cool, nothing wrong there. Alright, so we're gonna go ahead and take a look at your feet now. Just to make it a little bit easier, Jace, I'm gonna have you pop those shoes out for me, please. Cool. Thank you for that. So first thing I'm gonna have you do, Jace, just to check the range of the motion of the ankles, go ahead and push those feet down like you're driving a car. Yep. Bring those feet up towards the ceiling. Beautiful. Go ahead, bring them to the right. Go ahead, bring them to the left. Go ahead, turn them out like so. Cool, and then bring them in like so. Beautiful. So the ankles are working just fine. Go ahead and kind of feel down through here again. So no swelling through the ankles or the feet. That is good. And then you can go ahead, just for this, Jace, go ahead, pop your sock, whichever foot you want, but I'll have you pop one of your socks off real quick for me, please. Cool. So let's take a look at the feet. I'm gonna check your capillary refill here as well. So refill within a second, so you're getting good blood flow to the feet as well, so that's good. Do all the muscles there. Go ahead, wiggle your toes for me, please, Jace. Cool, so those are working well as well. No problems there, cool. All right, Jace, you can go ahead, pop your sock back off there. You're all good with that. Thank you. And then we got a couple more tests to do just to kind of test your muscles and make sure those are all working well. So you could go ahead and you'll just follow what I say here. So in a second, you're gonna get up from the chair, You're gonna walk forward, walk back, and then sit down, all right? You ready? I'll have you do it real quick. Beautiful. Have you walk back. Beautiful. That was just fine. Cool. Now you can go ahead, stay standing up for me, please. Beautiful. Alrighty. Next thing I'm gonna have you do, you are going to walk just on your heels. So walking forward just on your heels, and then coming back, you'll still stay on your heels. Good, beautiful, Jason. Oh, and then lastly, I'm gonna have you go ahead while standing. Go ahead, you'll be on your toes, walking forwards once again, and then coming back, still on your toes, walking back. Good, beautiful, Jace. Go ahead, have a, actually, sorry about that. Go ahead, stay standing for me, please. Thank you. Gonna do one more test over here. Go ahead, close your eyes there for me, please. Just gonna check your balance. Cool, so no problems there with the balance. Beautiful, Jace. Cool, you can go ahead and have a seat for me, please. Alrighty, and then we're gonna do a few more tests. This will be kind of checking the brain now, making sure that the brain is working all right. So, first thing I will have you do is, you can go ahead and bring that heel up against the shin. Yep, bring it on up against the shin like so. We'll test the other side, like so. Beautiful. All right, Jace. Next thing I'm gonna have you do, go ahead, have your eyes closed for me, please. Keep them closed. Go ahead, open up one of your palms out for me, please. I'm just going to write a letter. You just have to tell me what letter it is.
P.
Yep. Good, it's beautiful. Go ahead, keep your eyes closed and your palms open for me, please. I'm just gonna give you an object. You're just gonna tell me what object this is.
Rubber mallet.
It is beautiful. And then one more test. Gonna have you go ahead, cover one ear for me, please, whichever one. Yep. I'm gonna have you repeat exactly what I say. I'm gonna whisper it through your ear, and then I'll have you do so.
A, B, C.
Yep. Beautiful. I'm just gonna come on around, do the same thing on the other side.
A, B, C.
Beautiful. That is exactly so. Cool. Good stuff, Jace. All right. So we're all done assessing your muscles. Muscles are working all good, as well as the brain and the nerves. Those are all firing well as well. I'm just gonna do a further assessment on the heart now, the lungs, as well as the abdomen as well. So first thing I'm gonna go ahead and start with, we're gonna go ahead and take a look at the heart and then the vessels running all through it. So first thing I'm gonna do, go ahead and have your arms out for me, please, one more time. Yep, you can just rest those on your legs there. Beautiful. So I'm just gonna go ahead and take your pulse, take a look there. Cool, so those are working well bilaterally. Beautiful. Cool, and then you can go ahead, stay looking forward for me, please. Yep. And then I'm just gonna take a look at the carotids there, so I don't see any distension or pulsing through there, so that is good. I'm just gonna check them at the same time. Cool. Cool, so no problems with your peripheral vessels there, so blood flow is getting to where it needs to be. And then now, like I said, we're gonna go ahead and take a look at your heart and make sure there's no adventitious or abnormal sounds through the heart there, which can indicate some problems. So I'm just gonna put my stethoscope on. I'm gonna go ahead and take a look. So first I'm gonna take a look at that aortic pulse here, the intercostal. Cool. No problems there. Right there. Be ready to save your heart right there. Here's one. Cool. Go right here. Then we got one more. Beautiful. So your heart seems to be working pretty well, Jay. So I'm just gonna do one more thing with the heart and the blood vessels and all that. Let me just go ahead and feel for the pulse right here by the ankle, the posterior tibialis. Cool. Alrighty, and we'll go ahead and take a look at the pulse at the top of the foot there as well. Beautiful. So your blood is flowing just fine. Alrighty, so now I'm just gonna go ahead and take a look at your lungs, make sure there's no fluid or anything in your lungs, alright, Jace? So same thing, I'm gonna be using my stethoscope again to listen for some lung sounds, make sure there's no abnormal sounds, which can indicate problems with the lungs once again. So, actually real quick, go ahead and sit up tall for me. I'm just gonna feel through the back here while you breathe. Go ahead, breathe for me please. Cool, so have symmetrical chest rise and chest fall, so that's good. No problems there. Go ahead and get my stethoscope on, and then we can go ahead and start with listening to the lungs from behind here to start with. Alrighty, Jason, go ahead. Deep breaths for me, please. Alright, and again. Cool. Yep, keep breathing for me. Good. Good. Keep breathing. Good. Good. I'll listen to a few more here. A few more here. Beautiful. And one more. Cool. So I don't hear any abnormal sounds there. No worries or anything like that, which we don't want. So that's good. And then I'm just gonna listen to the front of your body now. Beautiful. So we'll start right here by the clavicle. So here. Good. Keep breathing for me. Good. Keep breathing. There you go. Go one at the heart. Good. And we'll go a couple at by the side here. A few deep breaths here. Cool. Good. Do a couple here. Good. Do one here. Beautiful, Jason. Cool. So seems to be that your lungs are working perfectly fine. So that's good. Did not hear any crackling, wheezing, breweries, anything like that. So that's beautiful. And then next thing we'll move on to, now let's make sure that there's nothing going on with the anything like around the abdominal area, so the stomach and all those organs over there. So we're just gonna say that we'll just say that you're on the table, yeah, on your back, beautiful, cool. So I'm just gonna inspect the area, cool. So it has a regular, the abdominals has a regular concave shape. I don't see any distension, no swelling or discoloration or anything like that, so that is good. Let me just go ahead and listen real quick one more time. Take a look here. Listen for any sounds in those 4 spots of your abdominals. Let me just listen for a few seconds each. Beautiful. Good. Yep, just keep breathing. Good. Do one more. Beautiful. Okay, so I don't hear any bruise in the abdominal area of your body, so that's good. Let me just do one more little test here. I'm just gonna feel through the stomach here. Any tenderness here at all, Jace?
No.
No tenderness, no pain. Cool. Cool. Good. Beautiful. Alrighty. Let's see. Just take another quick look at the skin there. Cool, so I don't see any problems with the skin. Just check this skin turgor. Cool, so it came back right away. So you seem to be hydrated then. No problems with the skin. Looking at a mole that I spotted, looks like you don't have any problems with the shape, the border, the color, or the size of the mole. So that is good too. So after looking at everything, Jace, you seem to be a healthy young man. You're alert and oriented to everything that's happening, to what happened today, the assessments that I did for you. You seem to be your age, 22 years old, young man, and you seem to be just a young, healthy young man. No problems with anything that I found. So that is all. That's all for my assessment. If you need anything, you can go ahead, just hit your call light, and I'll be right there. That's it. Cool. Oh.